So to start off with then, let's talk a little bit about this campaign. It's been launched on Tuesday. Tell me a little bit about why exactly this campaign is needed. Is this still an issue that people aren't fully aware of?
Yeah, that's exactly the issue which has been picked up. So it's very important to highlight that diagnosis of cancer, when it's made early, definitely carries a certain benefit, not only from the perspective of patients being diagnosed earlier on, but the treatment that they get, and if it's caught early, results in a better improvement in their survival. So this particular campaign, which is Be Clear on Cancer campaign, which has been launched by Public Health England, the Department of Health, and NHS England, which is a part of the National Awareness and Early Diagnosis Initiative in partnership with Cancer Research UK, aims to improve survival of England's cancer rate. And if you look at the data which has come out, in England about 10,000 patients, 10,000 deaths in relationship to cancer can be prevented each year if we start matching ourselves to the best in Europe, just by improving public awareness. And that's the entire aim of this campaign, is to make the public aware on the signs and symptoms of cancer, which can bring them forward, and hopefully we can pick these up much earlier.
Is there a particular age group who are most at risk here?
So this particular campaign, which is the Blood in the Pee campaign, focuses on identifying patients who have blood in their urine or blood in their pee, and the cancers commonly associated with this condition are bladder and kidney cancer. And the aim of this cancer campaign, obviously, if somebody has blood in the pee, needs to seek help. But we are focusing on patients above the age of 50, because this cohort of patients above the age of 50 is really where we want to come in and diagnose cancer earlier on and improve their survival.
Is there, you talk about the Blood in the Pee campaign, is there a risk that people are experiencing these symptoms and just ignoring them, thinking they'll go away?
Absolutely, and this is the real cause of concern that was picked up when this campaign was initially launched in 2012. So the key message from this campaign is that even if you see blood once in your pee, just don't ignore it. Come and seek help, because most of the time it may be nothing, but in about 20% of patients who come across with blood in their pee might have something more sinister going on, such as bladder and kidney cancer.
Obviously, you're right at the business end of things and your day-to-day work. Are there any other symptoms that people should maybe be looking out for, apart from the blood element? Sure.
So essentially, the majority of patients who have got bladder or kidney cancer, we expect blood in the urine or blood in the pee to be a presenting complaint. But additional symptoms, especially with bladder cancer, can be recurrent infections, which are coming about, which are getting more and more difficult to treat, or any significant change in the voiding function or voiding issues associated. And with kidney cancer, symptoms include rapid weight loss and pain below the ribs. These can also be presenting symptoms of kidney cancer coming about.
When you actually sort of intervene as part of your work, is that sort of in the later stages of these symptoms then?
So that's a really good question, because if you look at the presenting scenarios of patients coming across, I'll just give you some basic statistics as to what's been happening. So approximately every year in England, we have about 17,450 patients who are diagnosed with bladder or kidney cancer. And about 7,600 patients amongst these patients will die from the cancer itself. And when we've looked at the data as a part of this campaign, there are some very astonishing facts which have come to light. One is that about 3,340 patients in 2013 who had bladder and kidney cancers did go across and present themselves to A&E for the first time. And most of these patients had a background of these symptoms happening for a while. So the campaign aims to help prevent issues such as not going across to A&E in the first instant, and if a patient does have symptoms of blood in the pee, just don't ignore it. Come across, because there's a chance there might be something in the bladder or the kidney which can be diagnosed at a very early stage and be picked up.
I think sometimes people maybe think, oh, this is happening, I don't know what they're going to do about it. It'll, like we said, they think it will go away. But the people are there, the specialists are there to help.
Absolutely.
And support people along this journey, whatever it may be, as much as possible.
Yeah. So that's exactly what the message of the campaign is, because early diagnosis and treatment, be it in the case of bladder or kidney cancer, can definitely save lives. And patients also need to be aware that if they have symptoms, we do care about patients who have an issue with this particular symptom, and they should go and seek their help from their doctor and ask for advice. But even if you know of someone who's mentioned symptoms of blood in the wee to you, insist that they should go and see their doctor. Help them out. Push for them to go across and seek help, because the earlier we pick it up, the better it is.
Now, just talk me through some of the developments that have been made in this area in particular, East and North Herts. Services are being expanded, aren't they?
Absolutely. So at the Lister Hospital in Stevenage, where we're the cancer centre for urological malignancies, that's prostate, bladder and kidney cancers. So at the Lister, we offer robotic surgery for the bladder, and we also are offering advanced reconstructions of sort of new bags on the tummy, which is the conduits which patients have when the bladders are removed. And now we're also reconstructing new bladders with small bowel. So these are very advanced services. I also know for a fact that in the Pinal Hospital in Hitchin, they have a new clinic which is starting off from the 5th of March, which addresses doing all investigations such as scans and telescopic examinations of the bladder of patients coming across with bleeding on the same day, to just facilitate the diagnosis to come through quicker.
Do you think as well, because it is issues of the bladder, anything down there we're still a bit squeamish about? We don't like to talk about it, do we?
Yeah, most of the time patients have symptoms in relationship to their waterworks, and that could be due to just enlargement of the prostate in men, or with a background of a few infections in women. And the real issue which has come about in this campaign is the red flag symptom or the need to seek help is when there's blood in the wee. So that is the trigger which we request patients to notice. If they do know